Welcome to Uninsured by Choice, a podcast where we help you navigate the healthcare system without insurance. I'm your host, Dan, and our sponsor is Zion HealthShare, a nonprofit medical cost sharing community. Today, I am joined by Catherine Okubo, and she is a Brazilian Japanese immigrant and the CEO of MPB Health. MPB Health provides medical cost sharing programs supported by modern health and wellness services, with a team deeply committed to member satisfaction and human-centered care. With over 21 years of business experience, beginning her career at just 13, Catherine brings a diverse background spanning the fitness and vitamins industry, neuroscience studies, modeling, acting, and media. She hosted the Saúde Max health and wellness TV show for Brazilians living in the U.S. and is the host of the Healthy Care podcast. She also holds a Florida health and life insurance license. Above all, she's a devoted mom who enjoys time with her daughter and her cats. So, Catherine, thanks for joining us and being with us today.
Thank you for having me.
Yeah, of course. First question, I know we hadn't talked about this, but looking at your bio, starting at 13, why don't you tell us a little bit about how your career got started? That sounds like a story.
Yes. So my father has always been an entrepreneur in Brazil, and he had a vitamins and supplements company ever since I was born. Literally the day I was born, he decided to build his business. And at 13 years old, I basically wanted to spend more time with him. And I said, you know what, I want to start working with you after school. And when I started going to his manufacturing facility, he had, everything like a legal department, accounting department, sales, marketing. He allowed me to go everywhere in his company and just learn from everybody. So I really enjoyed business. I was like, wow, this is fun. I want to do it more often. And I've been working ever since.
That's so cool. Born to be a CEO. You're in the role you were made for.
Pretty much.
That's so great. So why don't you tell us just a little bit about MPB Health and what the company does and what you're working on over there?
Yeah, so MPB Health pretty much has medical cost sharing programs that we bundle up with other different types of amazing services, such as virtual pet telehealth is included at no additional cost in every single plan. You have the urgent care, primary care, all the basics that are included, mental health as well, included with a medical cost sharing program for alleviating those high medical bills. But in addition to that, because it's a whole different world than traditional health insurance, we also provide our concierge team, which literally helps the new members to navigate this whole system from everything they need, whether they need to just have a doctor's appointment booked for them or open a sharing request. Our concierge team will do all that. So basically, we're just changing healthcare little by little, as every new membership is somebody going from the traditional health insurance to this whole new world that they didn't even know existed.
Yeah, that's fantastic. That's what we're all about. Like we've talked about in the past, we are all about navigating the healthcare system without insurance, and you're playing a big role in that and helping people see that. So we'll get into later maybe who it's for and how they access it. But let's high level look. Health sharing, and we've talked about it on this podcast before. We've had other guests that know the health sharing industry, but for those who are maybe new to that term or the industry, that model, maybe you can contrast the traditional health insurance versus the health sharing program that you were talking about and how that works.
Yeah, so I think a lot of people here in the United States, when they look at healthcare, they immediately assume that the only option is health insurance. That's what I used to do before I knew about this whole new world. But it's very disheartening because health insurance, traditional health insurance, it's just a really, I don't know if I want to call it evil, but they profit off your sickness. I mean, that's what they do, right? Like they are going to be charging you thousands of dollars for a medication that costs $5 to manufacture, literally. They are, they have all these whole premiums, but the sicker that you become, the more you have to use that system. They want to keep you sick enough so you continue to pay the premiums, pay for medications, but not sick to the point where you die. So I just don't resonate with that philosophy at all. Like I don't want my hard-earned dollars to be going to a system that clearly doesn't care about the person, right? They don't have the best interests in mind. So then you have health share, which is this whole new world over here, and health sharing, which is medical cost sharing, the same term interchangeably. With health shares, it's a whole different type of philosophy and intention behind, right? So you have these like-minded individuals that are part of a community. They're all going to be sharing these medical needs, but also the intention is to truly heal, which again, health insurance, they don't want you to heal. Like, they are going to profit from your sickness. Health sharing, completely different. They want you to heal, because the less sick you are, the less you're going to be using the funds for the community. So the intention is very important for me. That's why, like, me and my team at MPB Health, we're just so happy every day to come to work, because we know we're working for like the light side. Like, we're not in the dark side. We haven't, we left the matrix. And we have this real mission here that we get to be part of every day. And whenever we talk with new members and people that join, they're like, wow, this is like too good to be true, you know? So we have to really explain to them how it works. Obviously, it's not the same, and it's not for everyone, because you know, if you're somebody that is into drinking alcohol every day or eating junk food all the time, we probably don't want you in the health sharing community, because in the health sharing community, you are really incentivized to be healthy. Like, there's a personal accountability to become a healthier person, because your individual health will affect the community, the entire community, because of the funds. So I just think that personally, philosophically, is it's just so, it makes so much more sense, and it's so much nicer to be part of that. Like, beyond also talking about how much you save financially, the mission and the intention, it's just wonderful in the health sharing community.
Yeah, love it. Earlier, we were talking about comparisons and trying to understand how health insurance and health sharing compare to maybe another industry. And you talked about the banking and finance. Do you want to share that example?
Yeah, so I think like a kind of a easy way to understand the traditional health insurance versus health share is to compare, like, for example, banks versus credit union. Like, a bank is very much like a traditional health insurance, where they have shareholders, you're just another account number. They're focusing more on profits over anything else. But on a credit union, like a health share, you are a member. You're not just another account number. It is not for profit. Usually they're nonprofit institutions too, and all of the decisions are going to be more aligned towards what's best for the members instead of like the shareholders. So I think that it's just an easy way to see how they both compare, because it's essentially the same thing but different.
Yeah, and the first time you mentioned that to me, I have been with a large banking company in the country, and I had been aware that credit unions exist, but didn't really know much about it. And so I've been talking to a local credit union. I've actually really enjoyed being a member of a health share myself, a nonprofit, mission-aligned organization. And so I thought, well, hey, if there's others like that, of course, we're not pushing credit unions, but it's the same concept. So members of a credit union might understand health sharing a little better in that it's a member-focused, member-oriented organization versus a financially oriented institution that's just there to hit certain number goals and revenues and shareholder dividends and all that kind of stuff. So really is a pretty appropriate comparison that I think more people will be a little more familiar with that terminology. So absolutely something to keep in mind. Another big comparison point that I know you brought up was the whole concept of open enrollment periods and the fact that insurance requires having that. You know, with the Obamacare marketplace, for example, I believe it's November 1st through December 15th if you want to get January 1st coverage for the following year. So you have a 6-week window where they let you apply and join outside of some sort of life event like a job loss or marriage, something along those lines. So I don't know of any health shares that have that same requirement. Maybe there are some, but I'm pretty sure that's another pretty big difference.
Yeah, I think that open enrollment is, like you said, it's such a short period that you have to make such a big decision for you and your family. And the fact that there's a deadline adds just unnecessary pressure. And they put it like in the worst time period where you have all these holidays too. So it's very inconvenient, right? Because they're so busy with Thanksgiving, with Christmas. I've liked to study throughout my life neuroscience. So you kind of understand how the brain works and operates. And when you have the open enrollment, it's kind of conditioning your brain and the population to think about health insurance every single year. But in addition to that, it creates like a conditional looping in your brain of basically you have like a deadline that creates an anxiety. And then you have you sign up and then you have a relief. Well, that makes your brain gets addicted to that type of anxiety relief cycle, kind of like in a toxic relationship, pretty much. So I think the open enrollment is a little bit of a psychological trap. And that's the beauty about health sharing. You don't have to have an open enrollment. You can join anytime. And let's say that you join a health share and then you got a job that now it's paying for your health coverage. Well, you can leave the health share. And then if you don't have that job anymore in a few months or a year, you can come back to the health share. So that kind of freedom for me, it's priceless. You just don't have to be part of that system with all these rules and stuff that you have to follow. You can, again, break free from the matrix. That's what we like to call it.
Yeah, and I think a lot of people don't understand this, but about 60% of Americans under the age of 65 will get their healthcare coverage through their employer. Employers also have open enrollment periods. Now, they're usually January or July. They'll have their open enrollment period for their employees. You'll have to pick which corporate supplied benefits you'd like to enroll in, and then that's that. You can't change it, even though you're employed there, and you would think that you've got that flexibility. So whether you go direct to the marketplace or something like that, or you get it via employer sponsored coverage, you still have open enrollment periods to fight in insurance. And with health sharing, that's just never really an issue, it sounds like.
Exactly. And it's just, again, it goes back to that philosophy. Like, I want freedom. I want the freedom to choose the doctors I see, to have, so you have no networks with a health share. I want the freedom to just come in and go as I please too. Again, if I have a job that's going to cover this, I will leave, but then I can come back. I don't know why do we have to be so tied up to this, the health insurance, right? But it's mostly because people don't know there's something else available to them.
And that's our mission.
Mm-hmm.
Uninsured by choice, knowing that you do have a choice. I think a lot of people don't think they have that choice. When Obamacare passed initially, it had the mandate to purchase health insurance, and I think a lot of people growing up at that time and now in adulthood are thinking, well, I have to have it, don't I? They don't know that it's not still a requirement. There's not a tax penalty outside of a couple states, it sounds like. So once people recognize there's alternatives, they can look into them.
Yeah, and we still have like new members that join us that when they're like, okay, so we want to join MPB Health, when is your open enrollment? They still think that they have to have an open enrollment. They can't join right away. So I think, like, again, it's really a mind shift when people come in with us and they become a member. It just changes everything. They're like, oh, okay, now I have to be responsible for my health. Now I should be keeping track of my medical bills. But they know exactly also how much they're going to be paying for their medical costs for the year. And then again, with the concierge team that we have, they do a wonderful job at explaining to people, helping them, doing things for them. And not only that, you don't have to wait hours, right? Because if anybody has talked with a traditional health insurance company, you wait like 2 hours on the phone to speak with somebody. And when you speak with somebody, that person, the customer rep, doesn't like their job, doesn't like what they're doing. You can tell. And that's a whole different experience here with the health sharing programs, where we have people that they will spend 2 hours with the customer on the phone if needed to make sure that they're taking the care that they need to. And it's actual humans, it's not robots. So I value that stuff. I'm sure other people do, other customers will do too.
Oh, absolutely. The human element is huge. Like you said, not just an account number, not just another name on a list, but an actual person on the other end. So let's talk about the people at MPB Health from your perspective. As far as you've obviously worked in this space for a long time, there's a lot of members of your health sharing programs. What type of people do you tend to see do really well in this health sharing model? Obviously, anyone healthy can really benefit from this, but do you see any trends or any patterns in people that you notice, hey, if you're in this situation, this is something you should look at?
Well, there is a couple for sure. Anybody that wants to spend their family, anybody that wants to have kids, like health share is great because you can end up having the only cost that you could have, it's like $1,250. And that's it, right? The cost of your initial and shareable amount. So I think it's a great program for maternity in particular. We have a lot of people that are like, yeah, I want to start a family, and they join the program. But in addition to that, anybody that is not getting obviously a government subsidy, right, as well. So you have those that join because of the mission, and you have those that join because of cost, because it's a better cost than if you're not getting any subsidies from the government. You're definitely getting a better cost with health share programs. And those are usually going to be the people who are self-employed, 1099, freelancers, because they don't have a easy way of foreseeing how much they're going to be making for their income wise for next year's. With the health share, you have these set costs, you don't have any surprises, and they're going to be getting like 40 to 60% less than traditional health insurance. It's been historically the way it has been, that these type of professionals, they've been basically penalized with higher premiums the more money they make. So with a health share, they really have a great option, and that's what we see a lot. And we have some programs that allows them to qualify for a health savings account, so they can even get even more advantages from a tax standpoint.
That's really good to know. Actually, I was self-employed for a time, and I went to the marketplace and got a plan. It was heavily subsidized. I actually looked this up beforehand, and the data is always a little hard to nail down. But as of this morning, the best guess is that there's about 23 or 24 million people who have their healthcare coverage through a plan on the marketplace. And there are about 26 or 27 million people who are uninsured. A good chunk of them are using an alternative like health sharing. I think that was at about 2 million members nationwide. People have hospital indemnity plans or other things like that, or Medicaid, for example, would be one that people qualify for. But the interesting thing is a lot of these 26, 27 million people could get a subsidy if they just knew how it worked. I didn't know how it worked for a long time. So what is that subsidy rule? So who would be able to get that subsidy, and at what income level are you kind of priced out of the subsidy where you should probably be thinking, let's pump the brakes on the marketplace and maybe look at a health sharing program, because it's going to cost you a lot less than these marketplace plans?
So, obviously it does change, right? So I think recently it was between 50 to 70,000. That was the income level, but there's obviously different ways. There's people that will change the numbers on their tax returns to make it look a different way, which they shouldn't really be doing that, but there's some that do. But honestly, anybody that is freelancer, self-employed, if you don't know how much you're going to make, if you don't know for sure how much you're going to make the next year, you should consider a health share, because at the end of the day, even if you get a subsidy, you're still going to have to pay that difference back if you make more than what you said you would, basically. So it's just a great way to not have any surprises, in my opinion. It's just it's smart financially.
Yeah, that's really smart. And that's something the broker I used when I got that marketplace plan, probably 3 years ago, maybe, specifically told me exactly what you just said. And I said, well, I'm getting into freelance web design work and doing these different kinds of things. And he asked me, well, do you know what you're going to make? I said, well, I don't know exactly. I've got some clients already, at this level and these kinds of things. And he specifically said, if you receive a subsidy at a certain income level and then you exceed that income level, you will have to pay back the subsidy when you do your tax return. So you really want to make sure you get that right. And that's a big concern, especially if you're projecting income at or around that, 70,000, it sounds like. If you're getting into 100,000, 150,000, you're getting to the point where you don't qualify for any subsidy. It's probably not even worth looking into a marketplace plan at that point.
Yeah. And the subsidies amount, they do change. So we might be talking about this now, but that number could change next open enrollment. So, it's something that I think it's just smart to know how much you're going to be paying regardless.
Even if you could get a heavily subsidized plan that's less expensive than a health share membership, the use of that plan, you're going to have a really high deductible. You're going to have a high out-of-pocket maximum. So if you ever need to use the plan, it's going to end up costing you far more than it would have. Like you said, last year I looked into maternity ones, and this time last year you could see health shares anywhere from 1,000 to 5,000 for maternity. You get a high deductible health plan that's $5,000 to $10,000 deductible, plus your huge out of pocket, plus co-insurance. You could be paying $10,000, $12,000 for a maternity event.
Yes. Yeah. So you're already paying like thousands of dollars for your premiums, and then you have to pay another thousands of dollars when you actually have to use it. It's really, but that's why when people compare it to a health share program, they say this looks too good to be true, but it is. It's a valid option. Again, not for everybody, right? It's if a person has a lot of chronic pre-existing conditions, maybe they're better off on a traditional health insurance. If they don't really care about their health, they're into the whole excessive drinking, okay, traditional health insurance is for you. But if you are a health conscious type of person, then you are going to definitely have a lot more benefits with health share.
Yeah, absolutely. So, what would you say to? I know we've gotten some interest from brokers, insurance agents, people who traditionally sell insurance products and services to individuals, to groups, different people. What would you say to these types of agents who are thinking, "Hey, maybe health sharing? Should I be considering this as an option to sell? Is that worthwhile?"
Yeah, so we work with a lot of those type of agents. Actually, we have very successful agents that used to be only selling traditional health insurance, and they became extremely successful adding health share to their portfolio. And our agents, they're just amazing because they truly, whenever they identify that the customer would be good for health share, they truly push for it, and they do a great job at explaining everything because it's different. It is different, right? And that's why we provide training as well for these new agents. We provide all the tools that they need to know that they're doing the right thing and they're doing right by their clients. But our agents, they love health sharing because first of all, it's way less paperwork. Second of all, once they sell it once, there's no renewals. They don't have to worry about it every open enrollment to renew that policy. They don't have to deal with that. They sell it once, and then our concierge team will handle their members for them, right? Any issues or questions that they might have, they can just call our concierge or go on our app and chat with our concierge team. So we really have like this catering or VIP treatment, let's say, for the clients and with the agents too. And they really appreciate that, because they don't get that with the traditional health insurance. So I think it's something great that every agent should consider adding to their portfolio of products, because they're going to be, again, saving money for their clients in many cases, but they're also going to be earning really great commissions too, and be part of a cause, like a true mission. And that's what our agents do. They're really awesome at that, and all of them have come from the traditional health insurance background.
That's really interesting because initially we were talking about how health sharing is a great option for self-employed, freelancers, 1099 contractors, people of that nature, gig workers. Maybe that sounds more like a direct enrollment kind of option. But a lot of agents or brokers might be thinking, well, geez, I don't work with a lot of individuals. I work with more small business groups, or 5, 10 employees or something. They can do it too, right? Even if you've got a group.
They can do it too. Whether it is an individual or a group, they can get the health share. We have it all.
That's great to know. I hadn't known all that about, in your case specifically, about the concierge service and those kinds of things. But some of the health shares will also have a similar type of thing, guide you through the questions to ask. Because a big thing that I think a lot of people get hesitant on a health share is, well, geez, I don't know how to go to a provider and not have an ID card to just show them and then let someone else handle it from there. No, with the health share, you go in and you say, I am cash pay. I want the cash pay discount. I want an itemized statement. And that's new for a lot of people. And so it can feel scary, right? But it sounds like your organization specifically helps with stuff like that. Some of the health shares will help too. Do you have any other advice for people who are thinking of maybe joining health share that might be intimidated by that type of thing?
Well, that's exactly why, it requires some education from the agent if they're working with an agent, and also from us. So every single new member that, if you might be scared of joining, well, this is why we have a whole process for it. Every single new member that joins MPB Health goes through what we call a welcome call. My team explains to the new member everything that is included in their membership, how to utilize it. We have an app. And our app is awesome because you can do everything there, right? You can chat with the concierge, you can call, you can open a sharing request through the app. You can just book your telehealth appointments. There's, again, mental health is included because we really believe in this holistic 360 approach to health, because you're not just your symptom. We don't want to you just have like a medication that fixes the symptom but doesn't go on the root cause. No, we want to go on the root cause. So that's why our membership is designed fully, even including pet telehealth. The member goes through this welcome call, and during the welcome call, they can ask any questions as well. They're walked down through every single step, what needs to happen, how it works. And then after, let's say they say, you know what, okay, I want to go book a doctor appointment. They can go on the app and do that themselves, or they can request our concierge team to do. And again, they actually know, oh, you know what, I'm going to have this big surgery coming up. They call us in advance. We handle everything for them. We work directly with the health share to do that and make sure everything is in accordance. And then we follow up afterwards to make sure that the member is okay, everything went through right. So it's really like holding hands in a sense, because we understand like this is a whole new world. You were used to and conditioned to the traditional health insurance for many years. Like you said, people want to just have that card and show it at the appointment. So it's a mind shift. But once they realize that, okay, with the mind shift, it comes all these other type of freedom, this whole other, I guess, system that I'm supporting now, then it makes sense. And they really love it. Like we have members that have been with us for years, and majority of our new members, they actually come from referrals because our current members love it so much and they refer us all the time. So if somebody is still on the fence about health sharing, they can just give us a call. They can just see what it is. If it's a good fit for you, like we don't want to sell for everybody. We literally have to sometimes tell people, you know what, because of your background, traditional insurance might be better. But if it is a good fit for you, then you will love to join the community, and you're definitely going to be welcomed. And we have a whole system and support in place for anything that you might need health related. So that's what MPB Health does really well. It's educating the members and our agents too. Like we work with agents all over the country, and they go through a whole training process with us, a vetting process, and they will be also very important in this educational piece for new members.
Yeah, I love it. I'm, again, a member of a health share, and I'm a cancer survivor. So I'm on surveillance. I get CT scans annually. And I remember last year specifically saying, I'm going to do something I've never even thought to do. I'm going to call these places. There were 3 where I live that would do the type of CT scan I need. And I'm going to ask them what it costs. And it was amazing how hard it was to get that. The fact that I even took that, I was very empowering that I can go find this out. Found out where I had gone previously was charging almost 4 times as much as another facility. And if I just went to a different provider, I could save a lot of money, both for me and for the community. In this case, it didn't even reach higher than the unshareable amount. And I saved that. That was me doing that. And I was just talking to someone yesterday about this who was saying, well, isn't it a lot of work to be in a health share? And I said, well, it's kind of like I was at the store shopping the other day and there was all this peanut butter on the wall. And I thought, well, I can pull out the peanut butter and look at the ingredients labels and understand what that means. Is it a little extra work? Yes. But I found one that's ingredients were peanuts and salt. I found a lot of others that had all kinds of other things in it that I wasn't super interested in putting in my body. I like simple ingredients. I like to know what I'm eating. And so I took that extra effort, a little extra work, but people who aren't averse to that and who are okay with doing maybe a little extra homework or research or something like that, HealthStream can work really well. It's not that hard. It's just, like you said, reconditioning yourself to say, I can actually do this.
Yeah, it's a mind shift, taking a little bit of personal responsibility. There's nothing wrong with that. And like you said, it's worth the extra work. Again, with the concierge team that we have, it's not like you really have to do much of the work anyways.
Yeah, that's great to know. Hey, we appreciate your time, Catherine. Really enjoyed the discussion. If any listeners want to get in touch with you, listen to your podcast, connect in any way, why don't you tell us the best way for them to find you online?
Well, thank you. I enjoyed the conversation as well. So you can obviously go to our website, which is www.mpb.health. And just a parenthesis, MPB stands for mental physical balance. That's what we're all about. And then I'm personally on LinkedIn under Catherine with a C, Okubo, and also on Instagram, that would be cat.okubo.
And then remind me the name of your podcast.
Healthy Care Podcast. So we're on Spotify and YouTube. We usually have a new episode every month, and it's about health and wellness.
Yeah, I'll definitely be checking that one out too. I remember seeing it earlier, and you'll have another subscriber from me. So thanks again for being on. Appreciate your time.
Thank you, Dan.
Yeah, anytime. Be sure to stay subscribed to us on every major platform, Apple, Spotify, YouTube. Stay tuned for upcoming episodes every other Wednesday. Follow us for more at uninsuredbychoice.com.